Welcome back. My next guest is Dr. Corey Hatfield, who is a rheumatologist with the Arthritis Center of Lexington. Welcome.
Thanks for having me.
There's nobody that I know that doesn't have some kind of arthritis, but arthritis is a little different, and I use the term rheumatologist. You deal with arthritis, or tell me what a rheumatologist does.
So we definitely see people for arthritis, but to me that kind of understates what a rheumatologist does. When I think of myself, I think of somebody who treats what we call autoimmune diseases, things like rheumatoid arthritis, lupus, scleroderma. You know, they do have arthritis associated with kind of all those conditions, which is why they get lumped together. But basically, you know, what I have special training is diseases of the immune system, where your body's kind of attacking itself. Like I said, the most common ones are things like lupus, rheumatoid arthritis, things of that sort.
And all those things cause arthritis because they attack the joints, but they also can attack other organs.
Absolutely, absolutely. They're systemic diseases. They can, you know, some of them can, depending on which disease we're talking about, it can pretty much attack anything, head to toe.
Now, what might be a clue or a symptom or a concern that they have one of the autoimmune diseases that they would need to see a rheumatologist?
Again, depending on the person, the disease they might have, the symptoms could be different. Our diseases can present many different ways. Some of them have rashes that are unexplained. Of course, joint pain, joint swelling, joint stiffness are kind of the classic symptoms of any arthritis, but there's generalized or B-type symptoms like fatigue, malaise that go along with our diseases. It could literally be anything.
Okay, and one of the ways, well, I guess one of the ways, there's a whole bunch of new treatments that you all are using. Tell me a little bit about them.
I tell people medicine's kind of like Baskin-Robbins. I can give it to you any which way. You know, we've got pills, we've got shots, we've got IV treatments. And if somebody says, you know, doc, I can't swallow pills or they upset my stomach, okay, I'll give it to you in a shot. They say, well, I'm scared of needles. Well, we've got infusions or IV treatments. And I always tell people, you know, you kind of start with the least invasive to the most invasive. You know, we usually start with the pills. If those don't work or don't tolerate, you know, there's medicines that come in injectable forms that we can give in the office or you can give at home. And then if the disease requires it or the person can't take it other ways, we can give it through infusions. And the infusions we do in our offices. We have 2 locations here in Lexington and 1 in London.
Now, you mentioned infusions. That's actually, you're giving it IV.
Yes, sir.
And you do it in the center. So tell me about the center and how that works.
So the Arthritis Center of Lexington, we're the biggest group of rheumatologists in central Kentucky. We have 8 providers. We have 5 doctors and 3 nurse practitioners. We have 3 locations that we're operating out of currently. We have 2 here in Lexington, 1 on Waller Avenue and 1 out in the Hamburg area. And then we have a satellite clinic in London where Dr. Brown, one of my associates, and one of our nurse practitioners, Amelia, go. And we see patients, and we're doing everything there. We have X-rays, we do DEXA scans, we do, you know, the autoimmune labs are somewhat difficult to do and interpret, so we have our in-house lab for all the specialty lab stuff. We do it ourselves, so we get it quicker, we interpret it, we feel like we have less false positives, all that sort of thing. We're kind of a one-stop shop.
So you talk about autoimmune disease. So if you've been diagnosed, you're getting infusion therapy, that's to tamper down, a lot of times to tamper down the immune system. Mm-hmm. That also makes you at risk for COVID, which we're dealing with right now. Are you concerned about your patients and that?
Of course, I think everybody's concerned about COVID. You know, for the last 3+ years, it's kind of, I think, dictated everybody's life. And when COVID first hit, you know, we got a lot of calls and cancellations and people saying, well, we may not want to take these medicines, and we were questioning whether we could give these medicines or not because they do lower your immune system. And the way I've looked at this, or the way I've kind of ratified it, you know, we don't know how long COVID is going to last or how long it's going to be a threat. Will it end, or if it'll end? You know, in the beginning we kind of thought, well, this is going to be a month or 2 and it's going to go away or whatever, but here we are 3 years later. You know, I can't predict if I'm going to have COVID or if you're going to have COVID, God forbid, or somebody else is going to have COVID, but I know these patients have severe rheumatoid arthritis, severe lupus, things like this. I know these medicines can help them feel better, it can slow down the progression of the disease, it can help them have a better quality of life. And so we have never stopped giving the medicines. We've never taken anybody off the medicines. There's never been a recommendation from the Arthritis Academy, the Academy of Rheumatology, any group telling us that you should take the people off these medicines or anything like that. We think it's in their best interest to keep their diseases controlled and keep them doing well.
That's great information. We appreciate you coming in, and thank you for the care you do.
Thank you.
So if you've got an autoimmune disease or arthritis, the Arthritis Center of Lexington can help. We'll be right back.